Next to caffeine, alcohol is probably the most commonly used drug in men and women of reproductive age. Despite being so common, there is still a lot that we don't know about how alcohol use impacts the chance for conceiving a pregnancy and having a healthy live-born baby. We know from recent studies that caffeine use in a woman before pregnancy is associated with a higher risk for early pregnancy loss. I talk about that in this video. But what about alcohol use in women before pregnancy? How about alcohol use in men before pregnancy? Hi, I'm fertility expert Dr. Randy Morris, MD. In today's episode, I'm going to explain the results of a new study that helps to answer these questions. Stay tuned to the end of this video. I will give you information on how you too can enroll in this study and provide additional information to help answer other questions about factors which influence fertility and pregnancy. It is well known that maternal alcohol use during pregnancy is associated with several adverse outcomes, including miscarriage and birth defects. Most pregnancy guidelines recommend avoiding alcohol during pregnancy. The effects of alcohol use before pregnancy are less certain. Preconception alcohol use by women has been identified as a risk factor for miscarriage in some studies, but not in others. The same is true for studies looking at male use of alcohol. Overall, there just haven't been many large, high-quality studies. The information I am going to discuss today comes from the PRESTO study. PRESTO stands for Pregnancy Study Online. Simply put, it is an ongoing web and phone app-based study of couples trying to conceive. PRESTO started recruiting people in 2013. Eligible participants are females aged 21 to 45 years who reside in the United States or Canada, are trying to conceive without fertility treatments, and have male partners aged 21 years or over. Participants provide information on their diet, exercise habits, medication use, and lifestyle factors, including alcohol use. Recently, the researchers from Presto published the results regarding alcohol use. In all, there were over 9,400 women, 2,600 were analyzed for this study. About 27% of females reported no alcohol use while trying to conceive, compared with 20% of males. Approximately 20% of the pregnancies in this study ended in miscarriage. For both men and women, they first compared 4 groups. Those that reported no alcohol use, between 1 and 7 alcohol drinks per week, between 7 and 14 drinks per week, and more than 14 drinks per week. After adjusting for many other factors, they were unable to find an association between alcohol use before pregnancy and miscarriage. The same was true for men and for couples. They also did an analysis looking at the type of alcohol, such as beer, wine, or other cocktails. Again, they could find no consistent impact of alcohol use on miscarriage. They also looked at miscarriages that occurred early, before 8 weeks, compared to after. Again, nothing. Our Infertility TV bottom line is this: the use of alcohol of any type by either men or women before conception does not appear to increase the risk for early or late miscarriage. This study did not address the ability to become pregnant. Other studies, including Presto, have shown a negative impact, so we would still advise avoiding alcohol on that basis, and of course, women should avoid alcohol if they are currently pregnant. If you are interested in enrolling in the Presto study and meet the criteria I listed above, go to this website, scroll to the bottom, and click where it says "Click to Enroll." Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.